Hello and welcome. Today, we'll be discussing cholangitis, a serious inflammation of the bile ducts. We'll explore what causes it, how it affects the body, and what can be done to treat and prevent this condition. So, let's dive in. Cholangitis is most commonly caused by a blockage of the bile ducts, most frequently from gallstones. These stones can migrate from the gallbladder and lodge in the common bile duct, obstructing bile flow. Other causes include tumors in the bile ducts or pancreas, strictures, which are narrowings of the bile ducts often resulting from previous surgery or inflammation, and less commonly, parasitic infections or congenital abnormalities of the biliary system. Endoscopic retrograde cholangiopancreatography, or ERCP, a procedure used to diagnose and treat bile duct problems, can also rarely lead to cholangitis. The pathophysiology of cholangitis revolves around the buildup of pressure and bacteria within the bile ducts due to obstruction. Bile normally flowing freely from the liver to the small intestine becomes stagnant. This stasis allows bacteria, which are normally present in small numbers, to proliferate rapidly. The increased pressure and bacterial overgrowth lead to inflammation, edema, and ultimately, damage to the bile duct walls. In severe cases, this inflammation can spread to the liver, causing liver abscesses, or into the bloodstream, resulting in sepsis, a life-threatening systemic infection. Cholangitis is not a particularly common condition, but its incidence increases with age, reflecting the higher prevalence of gallstones in older populations. Individuals with a history of gallstones, bile duct strictures, or previous biliary surgery are at increased risk. The incidence may also be elevated in regions where parasitic infections are more prevalent. While precise global statistics are difficult to obtain, it's estimated that a significant percentage of patients with gallstones will develop cholangitis at some point. The classic presentation of cholangitis involves Charcot's triad, right upper quadrant abdominal pain, fever, and jaundice, which is yellowing of the skin and eyes. However, not all patients present with all three symptoms. Some may experience only abdominal pain and fever. In severe cases, patients may develop Reynolds pentad, which includes Charcot's triad plus shock and altered mental status. Other potential symptoms include nausea, vomiting, dark urine, and pale stools. Diagnosis of cholangitis typically involves a combination of clinical evaluation, blood tests, and imaging studies. Blood tests will often reveal elevated white blood cell count, indicating infection, as well as elevated liver enzymes and bilirubin levels, indicating liver and bile duct dysfunction. Imaging studies such as ultrasound, CT scan, and MRI are used to visualize the bile ducts and identify any obstruction. ERCP is also both a diagnostic and therapeutic tool, allowing direct visualization of the bile ducts and the ability to remove stones or place stents. While the term ascending cholangitis is sometimes used, particularly in older literature, this simply refers to cholangitis that is caused by bacteria ascending from the intestines into the bile ducts. The core issue remains the inflammation of the bile ducts, whether or not it is ascending. Cholangitis can be classified by severity, such as mild, moderate, or severe, based on the presence of organ dysfunction and the need for intensive care. The primary goal of treatment is to relieve the biliary obstruction and eradicate the infection. Initial management involves intravenous antibiotics to combat the bacterial infection. Fluid resuscitation and supportive care are also essential. The definitive treatment is biliary drainage, which can be achieved through ERCP to remove stones or place a stent. In some cases, surgical drainage may be necessary. For patients who are too unstable for ERCP or surgery, percutaneous transhepatic biliary drainage, or PTBD, may be used to drain the bile externally. Prevention of cholangitis largely focuses on managing risk factors. This includes the timely treatment of gallstones, either through gallbladder removal, known as cholecystectomy, or non-surgical approaches like medications to dissolve smaller stones in select cases. Careful technique during biliary procedures like ERCP can help prevent iatrogenic cholangitis. In areas where parasitic infections are prevalent, preventative measures against those infections are also important. The prognosis of cholangitis depends largely on the promptness of diagnosis and treatment. With timely intervention, most patients recover fully. However, delayed treatment can lead to serious complications, including liver abscesses, sepsis, and even death. Recent research is focused on developing less invasive methods of biliary drainage and improving antibiotic regimens to combat resistant bacteria. Furthermore, studies are exploring the role of probiotics and other strategies to modulate the gut microbiome and reduce the risk of bacterial translocation into the biliary system.